Hi everybody, my name is Susan Wong from Capital Lifestyle, and today, wow, we have a special guest straight from New Delhi, India. She just landed literally 24 hours ago. We have Dr. Neena from Fortis Healthcare Group. Welcome to Capital FM. And Fortis, if you had no clue, is actually the second largest healthcare chain in India.
Yes, it actually has 54 hospitals across the country,
Wow,
mostly
54.
in North India. And I'm from one of the most prestigious ones, that's Fortis LaFemme. LaFemme, by the name itself, is the woman.
It's a
all about women.
woman-centric hospital.
Yes, absolutely. The
Wow.
patient is not patient, she's a pampered patient.
I think I should go visit one day if I need some assistance, medical assistance.
Yes.
So, Dr. Neena, you are a gynecologist.
Yes.
That's your field. I know a lot of us watching are probably thinking, I know what a gyne, it does, but really, I don't think we understand the extent of the services that you
Yes,
provide.
exactly. Because the moment you say gynecologist, the only image is somebody, a doctor who's delivering babies. But it's not like that. Gynecologist and obstetrician. Obstetrician is the one who's delivering babies, whereas gynecology is a big field in itself. It's all about gynae surgeries as well. So the treatment of fibroids, ovarian cysts, cancers in women, it all comes under gynecologist.
Understood. And in terms of women's preventative health, I think you must be leading that in terms of being a gynecologist. But now it's middle of the year. Are there certain things, like is there a checklist that every woman should think about?
Yes, definitely. As they say, prevention is better than cure any day. So better get yourself, time to time in different age groups. If I start from a younger age group, so the moment a girl starts menstruating, that's the time first gynae visit should be.
Oh,
So because sometimes the girls are young, they are shy, they feel,
yes.
they don't even come across and tell their parents everything in details, what's happening to them. There's a thing called puberty menorrhagia. She may be bleeding too much in her periods, which only a doctor will come to know. So one visit for preventive health at puberty. Then once you start becoming sexually active, that's the time, when you should really take care of your health. A simple test like pap smear, if you do it over repeatedly, can pick up cervical cancers, the cancers of the mouth of the womb.
Okay. And how often should a woman get a pap smear?
See, pap smear conventionally comes in one packet, in which we had to used to do it every year, to be fruitful. But now we have what we are doing at LaFemme is a much better thing. It is called liquid-based cytology, and if we combine it with HPV testing, HPV is human papilloma virus, which is the precursor of cancer. So we are actually checking that as well there now. So if we do this test, we combine both the test, and then the sensitivity to pick up cancer goes up to 92% to 95%. So in that, in fact, we can repeat every 3 to 5 yearly if we combine both the tests.
Right.
But conventional pap smear needs to be done every year.
Okay. And in terms of mammograms and other types of scans, maybe you can share more about the preventative things that we can do.
See, mammography is a thing which is used to pick up breast cancer. Okay. So, but at the same time, it has radiations. So you should not be exposing the body too much to radiations at a younger age. Mammography should be done as a preventive health thing only after age of 40. Before that, we should be doing ultrasound both breast. So which a lot of people again don't understand. They expose the body to radiations. But after 40, if you have a high family history, your mother or your grandmother or your sibling has had breast cancer, then every year. Otherwise, every 2 years after age of 40, mammography is good enough.
40 is the age.
Yeah, 40 is the age.
Okay.
Before that, you should go in for ultrasound breast. And if there's no strong family history, then 1 year you can combine mammography with ultrasound. The next year you can just screen with ultrasound breast as well.
Okay.
But definitely, you should know how to palpate the breast yourself to pick up lumps. That's really important.
Is it this motion? I think the last time I
See,
took a class was like
yes,
a
it
S
should
or
be
something.
with the flat of your hand, and the motion should be rotational. Especially when you're taking bath, with soapy hands, you can pick it up easily. So if there's any lump, so normally if you press your hands like this,
Yes.
you'll pick up the breast tissue itself. So that doesn't mean it's a lump. So if you palpate and feel it with the flat
So
of your hand in
circular.
rotational movements, circular movements, yes, and especially go right up to the armpit.
Like up here.
Yes, onto the armpit on both sides as
Okay.
well.
Okay. And if we suspect that we found a lump,
And definitely please visit a doctor.
okay, almost immediately, you're saying.
Yes.
So back to LaFemme. So what other services do you provide for women? I mean, is there prenatal things that you talk about?
Yes,
Also,
we talk about prenatal, how to prepare for pregnancy itself, because then again, I'm talking about your preventive thing again. So normally a woman who's, wishing to go ahead with pregnancy, she should have a prenatal visit with the doctor to do all the blood tests and to start taking folic acid supplement. Folic acid is a vitamin which we give to women 3 to 6 months prior to when she has to plan for pregnancy. It's a very inexpensive medicine. If you take it daily, it can decrease the complications during pregnancy, especially neural tube defects, the developing brain of the fetus.
right.
If the
right.
folic acid is deficient, can be hampered.
Okay.
And also it can lead to abortions, deficiency of folic acid. So your body should be fully loaded with folic acid. And also little things like your blood group, your thalassemia profile, your rubella status should be known before planning pregnancy. So that if you're not immune to rubella, then you should take the vaccine first and then plan pregnancy after 2 months.
And how far advance should you go for a prenatal visit before you plan to conceive?
6 months, 3 to 6 months is good enough.
Okay. Okay. And what other unique services does LaFemme provide to women?
See, LaFemme not only caters to delivering patients, but also for gynae surgeries as well as, like what I am specialized and my team is specialized is in minimal access surgery in gynae. Meaning thereby it's like a keyhole surgery.
Oh.
So since ages, we've seen that women have fibroids, and this part of the world especially, this belt has lot of tendency for women to have not only fibroids, 1 or 2, but multiple. I had a patient who had 254 fibroids in one sitting we had removed. 254 fibroids in one single operation we removed.
Wow. And how long was that operation?
It took good 4 hours.
Wow. And you removed all of them?
Yes, we tried to remove all of them. But the main thing is that you should try to preserve the uterus in the end. That's what
Of
is more
course.
important.
Okay.
So since ages, either the scar was this big from here to here, or the scar was like this. But now what we do is, we do a keyhole surgery. We make small ports, small holes, one for the scope and other for the ancillary instruments. And then in front of us is a big monitor or a screen. We look at the screen and we operate inside.
Okay, so the scarring would be at a
Very
minimal.
less. Minimal scarring. Everything is done through those ports. So the next day patient is good enough to get up on her own and walk back home.
The next day?
Next day itself,
Wow, the recovery
and all
period.
those, precautions like do not work for 6 weeks thereafter, no bed rest, nothing, less of bleeding, hardly any pain, post-operatively.
That's amazing. And Dr. Neena, just a little bit about your journey as becoming a doctor. Were you always interested in women's health?
Yeah, probably coming from a background of doctors. My father was a doctor, so we were living in a medical campus kind of a thing.
Oh.
So everybody around was a doctor, so it was expected that I would become a doctor. And of course, I know this is not being modest, but all the toppers, all the, girl toppers, would choose to go in for gynae. You know, that was the prestigious branch to go in for. So, and I was the best graduate of my, you know, the topper of all 5 years.
Wow.
So when you have good marks and you're the topper of the batch, you are invited to join gynae.
Okay.
So, and I don't regret it till date. It's a passion.
Well, it shows. I think this is the most pleasant conversation I've ever had with a gynecologist. Usually I get quite nervous because it's like, oh, I need to do this and that. But thank you so much for coming to Kenya. I know you might be still a little bit jet lagged, but I hope your visit to Kenya is fruitful and you can share your best practices.
We've had very good experience. We've had Kenyan patients as well through this firm called Pathways International.
Right,
I had a very pleasant experience with Kenyan patients.
That's great. So Pathway International is an organization based in Kenya, but they are leaders in the market for global medical and healthcare solutions. And we'll definitely provide all of their information in the description box below so you can get in touch. And if you would like to get in touch with Dr. Neena or the Fortis group in India, we'll also leave that information. Thank you so much for joining us, Dr. Neena.
Welcome. Pleasure was all mine.
Oh, it's mine too. Have a great day, guys.